Did you know that after 60, a simple, private habit you've probably been doing since your teens could slash your prostate cancer risk by up to 31%? As a doctor, I'm here to explain why masturbation might be your prostate's best friend. Hello, everyone. I'm Dr. Carolyn Foster, a urologist with over 20 years of experience helping men navigate prostate health. Today, we're tackling a topic that's often whispered about but rarely discussed openly: why masturbation may benefit your prostate after 60. This is unjust about breaking taboos. It's about empowering you with science-backed insights to take charge of your health. We'll discuss common myths, key scientific studies, frequency recommendations, and when you should see a doctor. Let's dive in. Imagine turning 60, discovering that the one thing society told you to feel guilty about could actually protect your health. Reducing prostate issues that affect 1 in 8 men. Let's break the silence on masturbation and prostate benefits. First things first, there is a lot of misinformation out there about masturbation and its impact on the prostate. Many people grew up hearing old wives' tales that painted self-pleasure in a negative light. But when it comes to prostate health, the facts tell a different story. One big myth is that masturbation increases your risk of prostate cancer. In reality, moderate masturbation doesn't raise that risk at all, and some evidence suggests it might even lower it. Contrary to popular belief, masturbation, if done in moderation, does not increase the risk of prostate cancer. Another common misconception is that frequent ejaculation causes prostatitis, or inflammation of the prostate. There's no scientific evidence linking masturbation to bacterial infections or chronic prostatitis. Those are usually tied to other factors like infections or pelvic floor issues. There is no scientific evidence to suggest that masturbation can cause prostatitis. Prostatitis is typically caused by a bacterial infection. And let's address the elephant in the room: the idea that too much sex or masturbation somehow wears out the prostate or leads to cancer. This is simply not true. Prostate cancer is influenced by genetics, age, diet, and lifestyle, not by healthy sexual activity. Some think that ejaculation flushes out harmful substances in the semen that could be linked to prostate cancer. Research results have been mixed. Dispelling these myths is crucial because fear can prevent men from understanding their bodies and seeking real benefits. It is uncertain whether masturbation has an effect on the risk of prostate cancer. Researchers need to conduct more studies before they can reach a conclusion. What if I told you that ejaculating 21 times a month is just enjoyable light spaving for men over 60? Backed by Harvard studies, this doctor explains truth might change how you view self-care forever. Now, on to the good stuff. What does the science say? Several large-scale studies have explored how regular ejaculation, whether through sex or masturbation, might protect the prostate. Particularly as men age beyond 60, when prostate issues become more common. One landmark study from Harvard's Health Professionals Follow-up Study tracked over 31,000 men for nearly 2 decades. Researchers found that men who ejaculated 21 or more times per month had a 20 to 31% lower risk of prostate cancer compared to those who ejaculated just 4 to 7 times monthly. A new 18-year follow-up data from the health professionals. Study in 2025 suggests that higher ejaculation frequency is linked to lower prostate cancer risk. An Australian study echoed these findings, showing a 36% reduced risk for men ejaculating about 7 times a week. And importantly, the protective effects seem to strengthen with no increased risk from early life frequency, but clearer benefits post-50 or 60. The 2016 study found that ejaculating more than 20 times per month reduced prostate cancer risk by about 20% compared to ejaculating only 4 to 7 times per month. A 2016 update to the Harvard data reinforced this, linking 20 ejaculations per month to a 20% risk reduction. It found men who ejaculated the most at least 21 times a month had a 20% lower chance of prostate cancer versus those who ejaculated 4 to 7 times a month. That said, Not all studies agree completely. The Mayo Clinic notes that while some research points to a slight protective effect, the evidence isn't conclusive, and the difference in risk is often small. Some studies have suggested that men with a higher frequency of ejaculations may have a slightly lower risk of prostate cancer. More research is needed, but the trend is promising. Regular ejaculation could be a simple, natural way to support prostate health without any downside for most men. Researchers found a 22% reduction in overall prostate cancer risk for men who ejaculated at least 21 times a month, compared to those who ejaculated between 4 and 7 times per month. Some studies suggest that having sex with frequent orgasms and ejaculation may reduce your risk of getting prostate cancer. Studies show regular ejaculation may reduce prostate cancer risk by roughly 20%. Prostate cancer kills more men than you think, over 34,000 annually in the U.S. alone. But what if a taboo activity like masturbation could lower that risk? Dive into the science that's turning heads and busting myths. So, how often should you aim for based on the studies? The sweet spot for potential benefits appears to be around 21 times per month, that's roughly 5 times a week. Remember, this isn't a prescription. Everyone's body is different. If you're in a relationship, partnered sex counts too. And if health issues like erectile dysfunction make ejaculation challenging, talk to your doctor about options. The key is moderation. Overdoing it won't supercharge the benefits, and forcing it could lead to discomfort. There is no medical guidance on how frequently a male should ejaculate. More frequent ejaculation in sex can offer numerous health benefits. Some studies have suggested that frequent ejaculation may reduce the risk of prostate cancer. But other research hasn't supported this idea. Overall, men who reported ejaculating at least once a week were less likely to have moderate to severe symptoms. And frequent ejaculation may well give you some protection against prostate cancer, especially if you're age 50 or older. There's no set number for how often a man should release sperm, but frequent ejaculation may lower prostate cancer risk. Forget the old wives' tales. Masturbation does undrain your energy, might drain toxins from your prostate instead. For guys over 60, this could mean fewer doctor visits and more vitality. Let's explore the facts. While regular ejaculation might offer perks, it's no substitute for professional care. Prostate problems can sneak up, especially after 60. So know the red flags. See a urologist if you experience trouble starting or stopping urination, or a weak stream. Frequent urges to urinate, especially at night. Pain or burning during urination. Blood in your urine or semen. Persistent lower back, hip, or pelvic pain. Unexplained erectile dysfunction or changes in ejaculation. Trouble urinating, stopping, and starting multiple times while passing urine. Painful urination, pain after ejaculation, blood in the urine. Also, start regular prostate screenings around age 50 or earlier if you have family history or are at higher risk. Like African American men, Dr. White recommends men begin yearly prostate cancer screenings at age 50. Screening methods include a prostate-specific antigen PSA blood test and a rectal exam. A PSA above 4.0 in anyone over age 60. Or above 2.5 in anyone younger than 60 will likely prompt additional testing. If the enlarged prostate is blocking the bladder outlet and giving symptoms severe enough to affect daily activities, such as slowing the urine stream, see a doctor. Dr. Parizzo recommends. Prostate exams start at age 50. If there is a family history of prostate cancer or other risk factors, the recommended age may be earlier. Age 50 for men who are at average risk of prostate cancer and are expected to live at least 10 more years. Age 45 for men at high risk. A simple PSA blood test and digital rectal exam can catch issues early. Don't wait. Early detection saves lives. Picture this. At 65, you're facing prostate enlargement symptoms, but a free feel-good routine could help prevent it. As a urologist, I'll reveal how regular ejaculation supports prostate health. No prescriptions needed. Society whispers that masturbation is shameful after a certain age. But science shouts otherwise, linking it to a 20% drop in prostate cancer. Odds post 60. Ready for the eye-opening details? 1 in 2 men over 60 deals with prostate problems. Yet a hidden ally lies in your own hands. Discover why doctors are now saying masturbation may be key to better prostate health. Shocking stat. Men who ejaculate frequently have up to 36% less prostate cancer risk. If you're over 60, ignoring this could be a mistake. Join me as I unpack the evidence on masturbation's benefits. What do Harvard researchers, Australian studies, and your prostate have in common? A surprising link to masturbation that could redefine aging gracefully. Let's shatter the taboos today. Topics like this attract attention because they challenge outdated taboos and offer fresh, empowering perspectives on men's health. Curiosity is a great motivator. Use it to prioritize your well-being. If this resonates, like, subscribe, and share with a friend. Questions? Drop them below. Stay healthy, and I'll see you next time.